Good morning and welcome to BMSS Family of Companies presents a Medicare update. My name is Jason Harkins and I'm the CEO of Payroll and Benefit Solutions. Before we get into the webinar, I'm going to tell you a little bit about PBS. We were founded in 2005 as an extension of Barfield Murphy Shank and Smith with the purpose of providing quality options for outsourced payroll processing for small and medium-sized businesses. In 2017, PBS created a PEO division, which allows for these same small businesses to have a team of outsourced experts in the areas of human resource benefits along with payroll services. In the years since, PBS has grown to over 50 employees, which serves over 1,000 payroll clients and over 5,000 employee lives under our PEO. Before we get started with the webinar, we've got a couple of housekeeping items. There is a Q&A button at the bottom of the screen. If you have any questions during the presentation, please put those in there. We will get to those questions at the end, or if some of them are more applicable to talk to during the presentation, Eric is wide open to answering those questions as we go. There will also be some polling questions if you'd like to receive CPE credit. Just look for those to pop up. They should be up for a minute or so. Just answer those. And I think that covers those housekeeping items. We are very fortunate to have Eric Smith of Medicare Advisors of Alabama to join us this morning to talk about Medicare and what you need to know as you prepare for retirement or have a family member or even have employees who are preparing. If you've not heard Eric speak before, he is great at being able to take the complex issues of Medicare and its different parts and break it down so it makes sense. Before we get started, let me give you a little bit of background on Eric. Eric has been helping people with Medicare issues for 18 years. Before starting Medicare Advisors of Alabama in 2017, Eric worked with Blue Cross Blue Shield of Alabama along with Viva Health. His mission is always to be kind and treat people as he would want to be treated. Eric grew up in Aniana, Alabama, graduated from the University of Alabama, and he's been married for 25 years, and they have one son who is a senior at Hoover High School. And I know we've used Eric at PBS when we have clients that have Medicare questions, so he's a great resource for us, so you're in for a treat. All right, with that, Eric, I'll turn it over to you.
Yeah, thank you so much, Jason, and BMSS and everybody just for giving me the opportunity to speak. I think that I love doing these kinds of presentations, and I hope you guys learn a lot. And let's just kind of jump in. So Medicare Advisors of Alabama, just to kind of tell you a little bit about us. As Jason said, we were founded in 2017. I've been in the industry for about 10 more years beyond that. We don't offer every Medicare plan, but we do represent 54 out of 56 Medicare Advantage plans, plus about 6 out of 14 drug plans, along with many Medigap plans. We do more than just Medicare, though. We help people with individual health insurance. That's either known as Marketplace or Obamacare. We also help with dental, vision, some life insurance, travel, and some various other ancillary types of insurance. But primarily, we focus on Medicare. And we're not a part of the federal government, just to make sure you guys understand. Anytime that you need to contact Medicare itself, it's 1-800-MEDICARE, or you can go to medicare.gov. There's also local entities throughout the state called SHIP offices. You can contact them to get information on every single option. But in today's meeting, we're not really getting into insurance companies or plans or things like that. We're really looking at Medicare more at a 30,000-foot view. And I hope that you guys can learn a ton. So let me tell you a little bit about our team. So I'm Eric. We've got a couple of other agents that work with me. So I started this in 2017, but Philip Richards and Dana Garvin joined our team some years ago. Debbie Patton, Trisha Raymond, those are more of our support staff. So they do really all the work. They make sure that we're operating correctly. And then we have a lot of other agents who work with us more independently. Think of us sort of as a realty company, a real estate company, where you have people who work maybe internally, but you also have real estate agents who, work with us externally as well. So we've grown a lot over the last couple of years. just I think from doing the right thing. We do get paid. Our revenues generated from commissions paid by insurance companies that we are contracted to represent. Commissions on Medicare products, however, are regulated by CMS. CMS, just so you guys will know, is the Centers for Medicare and Medicaid Services. So really, each company pays us the same amount of commission. So there really isn't an incentive to recommend one plan over the other. It isn't what we do isn't about enrolling people into plans. What we do isn't about sales. We think of ourselves more as Medicare educators with an insurance license. And honestly, living the golden rule and providing a valuable service is our mission. Just treat people like you would want to be treated. And that really starts with providing knowledge. I know that's one of, BMSS is, sort of goals is to provide to be the place for knowledge. We want to do the same thing. So let's kind of jump right into Medicare. So this book, this Medicare and You book that everyone receives is really handy. Tons of information in it. It's a fact-filled book. It walks you through the basics. The problem with this book is that if we don't have any working knowledge of Medicare or insurance, how do we know what questions to ask, and how do we know how to read through this book if none of this makes any sense? So one of the things that I get asked every day is, why do they make this so complicated? And they is always vague. Like, who is they? Is it the government? Is it insurance companies? But why? What they're really getting at is, why is it so complicated? And I think that's a legit question. But I always like to kind of talk through that question a little bit deeper. Like, one of the reasons it feels so complicated is that as we work, our employer provides us a benefits package that includes health insurance. The only choice that we ever make about our health insurance is what an employer offers us. So when we're looking at our employee benefits that our company is offering us, we're just simply choosing between this plan or that plan, high deductible, low deductible, this copayment, or really what's coming out of my paycheck. How much is this going to cost me? Most people are skeptical about the government's involvement with health insurance. People basically work their entire lives, and then you turn 65 and you're bombarded with phone calls and mail about Medicare. And so we have all of these things working against us. We've got our employers who's been providing our health insurance for all of these years. We've never really had to shop for insurance companies and health insurance. These packages are already put together for us. We turn 65 and we're told the government is telling us we have to do something, but at the same time, we're just getting, lit up with all of this mail and these phone calls. And with so many different parts and letters and choices and the fear of penalties, it'll make anyone feel that Medicare is impossible to understand. And then you reach out to a trusted friend or family member and ask them what choice they made, simply hoping that whatever they chose would also work for you. But then what happens is that choice, for whatever reason, may or may not work out. And then you're even more frustrated by a confusing system because you're like, I don't know what to do. I did what my mom did, but that isn't working for me for whatever reason. I have no idea how this works. And everyone's just guessing. So one of the most important things that I decided years ago is what everyone needed was a little bit of knowledge just about the whole program and how to make educated decisions. That knowledge, is what our mission is. And so we can help not by selling you an insurance plan, but by patiently helping you understand how it all fits together and what role insurance companies and brokers like us play. So that's the mission of this presentation, and I hope you guys can learn a ton as we go through it. So let's start with a little bit of history. I think it's really important not just to jump into the different parts of Medicare, but to kind of understand health insurance just in the US and how we got to this place related to Medicare, because it's going to help us understand these other things a little bit simpler. So really quickly, let's go back to like 1929. So Baylor University, that's in Texas, introduced what was known as a prepaid hospital plan to a group of Dallas school teachers for 50 cents per month. This was sort of the precursor to employer-provided health insurance, and this concept became Blue Cross. So As time went on in the 1930s, the American Hospital Association was formed, and that began to standardize these hospital plans that were being offered to employers. That led to the creation of Blue Cross. Well, physicians in a completely different part of the country were starting to be concerned that the hospitals were going to dictate how much the physicians paid. So they wanted to maintain their autonomy and fee payment structure. So they formed their own insurance plan known as Blue Shield. Both of these companies, Blue Cross and Blue Shield, were completely independent and remained that way until 1974 when the Blue Cross Blue Shield Association was created. There's a reason why I want to kind of explain this whole background of Blue Cross Blue Shield, because in the 1940s, during World War II, wages were frozen, and that led to employer-based health insurance being a key benefit from employers because if wages are frozen and an employer was trying to attract new employees, how do they do that if they can't tell you that they'll pay you more than the next guy? So what they did was, let me provide you employer-based health insurance. So you had these two entities, this Blue Cross hospital insurance and this Blue Shield physicians insurance being sold to the employers, and the employers were able to attract the employees. And then what happened was is that this was happening throughout the 40s, and at the same time, as World War II was kind of coming to a close, Harry Truman was advocating for a national health insurance program, but the proposal was defeated, and then employer-based health insurance kind of became the norm, and it is still today. So in the 1960s, as employees retired, well, they no longer received employer benefits, right? So if you're not working for your company and you're not providing anything to the company, then the company can't really provide benefits to you. So this aging population in America really had no health insurance as they were seen by insurance companies as too risky to insure. So you're getting older, you're going to the hospital more often or the physicians more often, you're not contributing as much work to the company. So how do we as an insurance company insure this individual? So at that point, President Lyndon Johnson signs Medicare and Medicaid Act into law in 1965, and that created Medicare Part A, which is hospital insurance, and Part B, medical insurance, essentially mirroring this Blue Cross Blue Shield structure that had been in place for all of these decades. And then basically Medicare was this exact same way from 1960s until 1997 when the Balanced Budget Act introduced Medicare Part C. That allowed private insurers to offer Medicare benefits. It was originally named Medicare Choice and it later became renamed to Medicare Advantage. And then in 2003, something known as the Medicare Modernization Act of 2003 was created. It created a Part D plan, which provided prescription drug coverage, and it became available to the public in 2006. So when you kind of just go through, this timeline, you have an establishment of Blue Cross, you establishment of Blue Shield, you have employer-based benefits, you have people coming off of the employer-based benefits and on to Medicare, as they retire. So that little brief of history, I think, at least for me, kind of gives us a starting point, and then we can kind of move forward and jump into more definitions of Medicare itself. So there's four major parts of Medicare. I sort of mentioned them just a second ago, but Part A is the hospital insurance. This part of Medicare is funded through payroll taxes. It covers inpatient hospital stays like skilled nursing facility, hospice care. Its structure and financing are a direct echo of the nonprofit Blue Cross plans that covered hospital services. Part B is medical insurance. This program is where beneficiaries pay a monthly premium that covers physician services, outpatient care, and other medical services, and it mirrors the Blue Shield model of paying for doctors' fees. Part C, it's known as Medicare Advantage, is more of an all-in-one coverage from private companies. It combines A, B, and D, plus some extra benefits such as dental and vision. These plans look very similar to employer coverage with physician and hospital networks, co-payments, and maximum out-of-pockets. And then Part D is prescription drug coverage. It's available through private insurance companies, but approved and regulated by the federal government. So these are just sort of the definitions of it. And then obviously we're going to dive a bit deeper. So who qualifies for Medicare? Um, this is a thing that people get confused a lot because most people don't understand the difference between Medicare and Medicaid, and you hear these two things sort of used interchangeably. Just so you'll know, Medicaid is aid. That is a state-based program. That aid is to help people who have very limited income. Medicare is for people who are 65 and older, disabled permanently for more than 24 months, having end-stage renal disease or ALS, which is known as Lou Gehrig's disease. To be eligible for it, you must be a citizen or a U.S. resident. So primarily we think of Medicare for somebody as 65 or older, but it also is available for people who are under the age of 65 but disabled for more than 2 years, or been diagnosed with end-stage renal disease or ALS. So let's kind of get into the different individual parts. I hear a lot of people say Part A is free. It is not free. Just so you guys will get let in on a little secret, nothing is free. Most beneficiaries, however, receive Part A at no cost, not because it is free, but because you have earned it over your working years. So as you have worked throughout your life, you're paying FICA taxes. If you're not working and you're married to somebody who's paying FICA taxes, then they're paying them on your behalf. So if I've worked more than 10 years, I have more than 40 quarters of work history, then when I become eligible for Medicare Part A, I'm not going to pay a premium. But if I have less than 30 quarters, that means I have less than 7.5 years of work history. My Part A premium would be $518 a month. If I am um, 30 to 39 quarters, 7.5 to 10 years of work history, I would pay $285 per month. So this is just something important to kind of keep in mind. Most people, though, for our conversation, we're going to say Part A has a zero premium, but I just wanted to show you guys that some people do pay something for Part A if you didn't work enough or you're not married to somebody who had enough work credit. So that's, I think, always important to kind of keep in mind. Part B, this is the physician's portion. So when we think of A, think of that as hospital, buildings, beds, nursing staff, employees of the hospital. Part B, or the physician's portion, that's doing all of the other work outside of the hospital. So when you think of outpatient surgeries, you think of primary care doctor visits, you think of, physical therapy, all of these types of things, that falls under Medicare Part B. The average monthly premium for Medicare Part B is $185 per month. That premium is deducted directly from your Social Security check or is paid directly to Medicare if you're not drawing Social Security. The premium, however, is based on your adjusted gross income on a 2-year look back. This is known as an IRMA, also known as an income-related monthly adjustment amount. It can be appealed if you've had a life-changing event, such as a work stoppage. So let's kind of dive into that just to kind of a little bit, just to kind of see what I meant by that. So if I am working and I'm retiring, my income while I'm working may be higher than when I retire. So in 2025, at the beginning of 2025, and even today, with people are filing an extension on their taxes from 2024, there is no, history of what you made in 2024 until we get deeper into 2025. So this is the reason why we have the 2-year look back, because when we get to the year 2025, the only thing that the IRS and Social Security can verify as far as your income goes is 2023. So I'm retiring is 2025. They're going to look at my tax return from 2023. They're going to go to the 1040 and they're going to look at line 11 and they're going to look at line 2A. And they're going to add those two numbers together. And if I'm single and my income is less than $106,000 that year, then the standard Part B premium is what I'm going to pay, which is $185. However, if my income is higher, or if I'm married and I'm making more than $212,000 a year, then I'm going to pay a higher Part B premium. And you'll see as we kind of go down through this chart, if I make say $250,000 and I'm married, then the premium is going to be $185 for Part B. They're going to tack on what's called an income related monthly adjustment amount to my Part B premium of $74 per month. Then they're going to tack on an additional $13.70 for my Part D income adjustment for a total monthly premium of $272.70. So Part B, $185. My income is higher. They're going to tack on a 74 premium and a $13.70 premium for a total of 272. Same thing happens as I go up the income scale. If my income is above $750,000 a year as a married couple, the highest Part B premium I could pay at the moment is $714.70. So it can be up there as far as premium goes for Medicare Part B. But if I leave work and my income is going to be dramatically different now that I've left work. So let's just say, yeah, in 2023, I made, $250,000, but now that it's, 2025 and I'm retiring, I anticipate my income in 26 to be significantly less than $212,000. There's a form that I can complete called an SSA 44, which is simply a life-changing event form. And that form says, I've had a work stoppage, or I've had a work reduction, or I've had a death of a spouse, or something like this. And you just simply let Social Security know, this is what this life-changing event is. This is what my income has been, and this is what I project my income to be in the future. And they'll take your word for that. And they'll move you down to the lower level. And so that's something to kind of keep in mind. But our conversation, though, for today, I'm going to focus on the Part B premium as $185 per month. But I just wanted you guys to kind of understand that the premium can be higher just based on your income. And we help people with this. We help people understand this. We also help people complete those SSA 44 forms. And we submit those to Social Security on people's behalf if they want us to do that. So just things to think about as we kind of go through and talk through more stuff related to all of this. Just to kind of make a quick point about Part D. So I defined it earlier. Part D is the prescription drug portion. The Inflation Reduction Act was passed in 2022. It's also known as the IRA. It initiated some major changes to Medicare Part D. The number one thing, how it impacts you or somebody that you know as a Medicare beneficiary, is that it provided a maximum out of pocket. In 2025, that max out of pocket is $2,000 for all of your Medicare prescription medications. In the past, there used to be something called the donut hole, where somebody would have to pay a lot more for their medications at certain times of the year, depending on their cost. Very, very complicated and very, very expensive for an individual. As of 2025, prescription drugs are capped at $2,000. I was on the phone with someone just yesterday who said, my medications are so much cheaper this year than last year. And that's because they've reached this $2,000 cap. And now for the rest of the calendar year, they haven't been paying anything for their prescriptions. Something else that was passed within that Inflation Reduction Act is what's called the Medicare Prescription Payment Plan. It's known as the M3P program. This is a program that allows beneficiaries to pay for their high-cost prescription drugs in monthly installments throughout the year instead of all at once at the pharmacy. This is really important for people who may be in a plan that has a high drug deductible. So let's just say you go into the year and your deductible is $500 and you have some really expensive medications that may cost you, $500 or $1,000 per month. And even though the cap is at $2,000, you may not be able to afford $1,000 in January and then $1,000 again in February. What they do is allow you to pay directly to the insurance company instead of at the pharmacy. And they take that $2,000 and divide it into 12 equal monthly payments. So it makes it a little bit easier for people to pay their medications over time than this exorbitant amount right at the beginning of a year. For 2026, the $2,000 amount goes to $2,100. So it will go up over time, but it started at $2,000 in 2025, and then you have this ability to pay it monthly if you need to. So that's really, really new. This is my favorite page. So this page kind of is where I spend the bulk of my time. Um, I call this a Medicare skeleton because everything that I've talked about so far is very definition. We've gone through a little bit of, history of Medicare, and we've talked about this whole Blue Cross Blue Shield idea, how Part A and how Part B kind of became a thing. I've mentioned Part C, I've talked about Part D, but at the end of the day, how does it actually benefit me and how does it work? Because I've been covered under my employer coverage all of these years. And again, I'm getting all of this mail and everybody's telling me to do something, but I don't really understand how it works or how I'm supposed to pick a plan. And this is a really nice visual. And I call it a Medicare skeleton only because it's sort of the bone structure of Medicare, if you will. I think it's good to kind of break things down really simply. So I'm going to pull out my little handy, well, I may not be able to on this, but I was going to pull out a little pen and kind of draw, but I don't really need to. But the most important thing I kind of want you guys to understand is that there's two ways to receive your Medicare benefits. That's really the most important thing here. There's what we call traditional Medicare. In traditional Medicare, what that does is that simply is the way we originally talked about Medicare. We have this fee for service model. So you see on the left-hand side where it says traditional Medicare fee for service. What that means is that my physicians are going to receive a fee for the service that they provide. The federal government is going to pay that fee schedule. So I'm going to have Medicare Part A. I have Medicare Part B. I'm paying $185 a month for Medicare Part B. I'm paying no premium for Medicare Part A. So my basic fundamental cost of Medicare is $185 per month. Part A, if I got admitted to the hospital, I'm going to have to pay a substantial deductible of $1,600. If I go to the physician's office or I have an outpatient procedure, I have a $257 deductible. But the real kicker is me as the Medicare beneficiary is going to pay 20% of my claims. So fee for service, the government sets a fee. I show this Medicare card. The government gives my physician 80% of that fee schedule, and I'm responsible for 20% of whatever the remaining amount of that fee schedule is. This is how Medicare was established in the 60s. Nothing has changed with that. I still owe 20% of my claims. The problem with the 20% is that it's 20% of an infinite number. There is no cap to what that 20% could be. You just pay 20% of whatever the amount is. So that means lab work, x-rays, physician's fees, surgeon's fees, anesthesiology fees. The government's paying 80%, but I'm left responsible for 20%, and I have no idea how to budget for that. So under traditional Medicare, if I have a Medicare card, I need to insure myself against that 20% by purchasing what's known as a Medicare supplement, also referred to as a Medigap policy. So we have this second card here, this second little box. This second box is not a part of the federal government's Medicare system. This is you going to an insurance company saying to them, hey, I have a Medicare card. Can I pay you some money to pay my 20%? Think of this Medicare supplement policy as car insurance. So if you purchase a car, you can go to State Farm, you can go to Geico, you can go to Allstate, and you can say, hey, I just bought a car. Can I insure it? Can I give you some money per month so in case I get in a wreck, you pay you help me pay for a new car or have it fixed? They say, sure. They come up with a price. Medicare supplement policies work the exact same way. They're regulated by state departments of insurance. They have nothing to do with the federal government, except that the federal government steps in and says, if you're going to offer a Medicare supplement policy, we need to make them at least standardized. So if you purchase a Medicare supplement policy in Montana, it looks the same in Alabama and New York, but different insurance companies have different prices, just like State Farm may have a different price or Geico may have a different price for car insurance. Medicare supplements can do that as well. So when I talk about them being standardized, think of a Medicare supplement not only as car insurance, but as a car. So think about like a Toyota Camry. If I choose a Toyota Camry XLE, that's a specific type of car that I want. Now I'm specifically shopping dealerships to look for that type of car, which will give me the best deal for what I'm looking for. So if I decided I wanted a Medicare supplement plan G, which is the most common type of supplement, followed by plan N, then I'm trying to figure out which insurance company is going to give me the best deal for that. But whether it's insurance company, 123 over here, a plan G is the same as if I chose insurance company 345. So it's the same thing. We're just trying to figure out, what is this insurance company offering me that the other one doesn't? Am I getting, you know, free oil changes for the first 2 years? Am I getting car washes? What's the benefit to me of buying this car from this dealership versus the other one? The concept though, Medicare is paying the fee. I'm hiring an insurance company to pay the remaining amount of that fee. So if one card is paying 80% and the other card is paying 20%, I owe 0%. So this Medicare supplement policy here steps in and removes this deductible. So I don't have a hospital deductible. It steps in and pays this 20%. What it doesn't do, however, is pay my Part B annual deductible of $257. So I have traditional Medicare. I've bought a Medicare supplement policy. The standard price of a Medicare supplement policy is about $175. And that varies wildly. Some supplements, especially plan ends where you may have some co-payments at the physician's offices, can be as low as $100 a month. But some supplements can be as high as $300 a month. So there's a huge range in cost of Medicare supplements. But just know that if I have a Medicare supplement and a Medicare card, I'm going to pay two separate premiums. I'm going to pay the premium for Medicare of at least $185 per month. My Medicare supplement policy, which is probably going to be about $175 per month. The benefit is that it's federal. I can go to any physician, any hospital in the country that accepts Medicare, which is basically the whole country, and pay nothing out of pocket except for a deductible of $257.
Hey,
So,
Eric.
yes, sir. Yeah, go ahead.
Hey, on those Medicare supplements, I'm assuming you would have that card, and when you go to the doctor, you would present that. Are physician offices, does that kind of rattle them? Are they used to seeing these, secondary cards? I've seen this with just primary insurance, and it's become pretty common for secondary, for people to have a secondary insurance card along with their Blue Cross card. What has been your experience of how offices handle these Medicare supplement cards?
Yeah, so way more common for a Medicare supplement than a employer group Medicare, a employer group supplemental card.
Yeah.
That's relatively a new concept over the past like 10 years for companies to go to a high deductible plan and then supplement that with an insurance plan. It's very effective. I think doctors' offices are becoming more familiar with how that
Yeah.
works. This has been this way since the 70s.
Okay.
So this is way more common. And the other thing that's really helpful on this, that's a little bit different from companies, is that the physician's office or hospital doesn't have to bill the supplement secondarily. As long as they file the claim to Medicare, that supplement typically is on file with the federal government. And there's something called bump billing, where the government just kicks over that remaining amount of the bill to the supplement that's on
Okay.
file, and the physician doesn't have to file a secondary claim.
Okay.
So
Yeah.
even more simple.
Yeah, I can see why that's a lot easier to process versus the other.
Yeah, and you'll hear physicians' offices, not necessarily the physicians themselves, but you'll hear billing people at times that'll say something like, "Oh yeah, we prefer people to have Medicare and a supplement," and honestly, it's because the billing is simpler. I'm sending it to one place, and we're going to get paid 100%. Like And I don't have to tell a person how much they owe. You're going to get a bill if you haven't met your deductible yet, because the government knows how much of that deductible that you've met, and the billing person has very little to do. They just submit a claim to Medicare and they get paid. So, but the downside is I have two different insurance cards and I'm paying two different premiums.
Right.
So if I have higher income, I may be paying a higher Part B premium, and also depending on the version of supplement that I have, I may be paying a premium for a supplement. Um, does that help answer that question?
Yeah, absolutely. I was just curious how it compared with, your primary insurance, and it sounds like it's much more streamlined as far as processing.
Varying. Yep. The thing that's interesting about Medicare is that because it started in the 1960s, these Medicare supplements, like I said, have been around since the 70s. Drug plans, like I had mentioned earlier, that didn't even pass until 2003. It went into effect really for people in 2006. So you did not have standalone Part D plans prior to than 2006 for somebody to enroll in. So what happens with traditional Medicare, you can sort of start to get a sense of we're itemizing and piecing our Medicare insurance together, right? Because we've been working our whole lives. An employer has packaged this stuff together for us. So if you think about an employer, what they have done for us is they're providing health benefits, physicians benefits, drug benefits, dental benefits. This is our package of benefits, right? Our health package. Well, once we go on to Medicare, now it's unpackaged and I'm sort of doing it on my own. I have Part A that the government provides because I've paid into it. I have Part B that I'm paying a premium on. Now I have to go shop for a supplement to pick up what the Medicare card doesn't pay. And now I have to purchase a prescription drug plan from another insurance company because the government doesn't sell you a drug plan directly. They allow insurance companies to administer the drug plans. And then I have to shop for what is my deductible? What are my co-payments for prescriptions? What's my monthly premium? Because I also have a premium for my prescription drug plan. If I want dental, I need to add that separately. If I want, some other kind of benefit, whether it be a vision benefit or whatever, I've got to buy that separately. One quick note about vision that a lot of people don't think about: the vast majority of things that we do related to vision is going to fall under your medical claims. So think of glaucoma, cataracts, macular degeneration, these kinds of things. Those are medical claims. That's going to fall under your medical benefits. Where vision insurance comes in is, how much do I pay for those progressive lenses? Well, am I going to get a discount on those? Do I have an insurance plan that's going to pay something toward my, designer frames or whatever the case may be? Medicare doesn't do any of that, but it does cover for the major medical type stuff, the cataracts and the glaucomas and medical and eye, medical issues. But just to kind of recap, traditional Medicare, or what we're known as original Medicare, you have um, Part A, Part B, those you receive from the federal government. Medigap, Medicare supplement policies, you pay that secondarily from an insurance company. And then a Part D plan, you buy from an insurance company, but the federal government oversees it and regulates it. This is the traditional Medicare route. Medicare Part C, or the right-hand side of this page, was passed in 1997. It really didn't become popular until probably 2007, 8, 9, and then over the last, I would say, 10 years has become more popular. The reason why is because it combines all of these different pieces: your hospital insurance, your physician's insurance, and your drug insurance into one plan. It allows the Medicare benefits, instead of it being fee for service where the government pays my physicians and then I have to supplement my card, it allows an insurance company to administer all of my Medicare benefits on my behalf if I choose to do that. So me as a Medicare beneficiary, I have a choice. That's what the C stands for. Do I choose Medicare Advantage or Part C that allows me to bundle my hospital, physician, and drug coverage into one package? where it's bundled together, more similar to my insurance that I've had at work. I still have to, I'm required to have Medicare A and B. So whatever I pay for Medicare Part B, I'm going to pay on a Medicare Advantage plan. But many Medicare Advantage plans will charge a $0 premium per month. That does not mean that it is free in any way. It just means that the money that I pay the government for Medicare is going to be shifted to an insurance company. The insurance company is going to receive money from the government because they're administering it. But then the insurance company has a lot of competition because there are a lot of insurance companies who want to offer these plans to you, and competition will push the premiums down. And if one company is offering a zero premium, then two companies offer a zero premium, and then you have 7 or 8 companies offering a zero premium. And then what happens is I pay the Medicare Part B premium, but then when I go to the physician's office, I'm going to pay some kind of co-payment. I'm going to pay $5 or $10 for a primary care doctor, or $30, $40 for a specialist. My outpatient surgery may be, $250 or $300. It's going to look and feel a lot more like insurance I've had at work, except I'm paying a lot less per month because I don't have to buy all of these separate insurance policies separately. It's the concept of this bundle and save. You see these commercials all the time on television about bundle and save. It's the same concept here. I have a Medicare Advantage plan. I have Medicare. I've chosen A, B, C, and D all packaged together, and I'm going to let an insurance company administer it. These insurance companies will throw in some added benefits because, again, there's a lot of competition. They'll throw in a dental benefit that's not included under traditional Medicare. They'll throw in an allowance for glasses. Maybe they'll throw in a hearing benefit. Sometimes they'll throw in a gym membership. There's a lot of different things that they'll throw in to kind of, what I call shiny objects to get your attention to kind of say, hey, look what we can do kind of thing. There's some things that are required with Medicare Advantage plans. I often hear that if I choose a Medicare Advantage plan, I can't travel, like I have to stay in my state. Well, that doesn't make any sense. The government wouldn't even allow that to happen. So a Medicare Advantage plan has to cover emergency room visits, urgent care, dialysis throughout the US, regardless of what insurance company that you have. They also are required to provide a maximum out of pocket, where that 20% under the traditional Medicare route is uncapped, so I have to supplement it. Well, the government requires a Medicare Advantage plan to have a maximum out of pocket, and the government regulates that and says you can't charge more than X per year. So insurance companies have a lot more risk on a Medicare Advantage plan because if you reach that maximum out of pocket, if your co-payments reach that, then the insurance company is responsible for 100% of the cost of your medical care for the rest of that calendar year. You're not opting out of the Medicare system. You still have Medicare. And so if an insurance company doesn't pay a claim that they should have paid, you have an ability to appeal to CMS, which is the governing body. And if they find that an insurance company is not living up to the promise of Medicare, the government will crack down on Medicare Advantage plans. Over the years that I've been doing this, I've seen some major insurance companies receive sanctions, financial penalties, suspensions. Doesn't happen all the time, but it absolutely can happen. So insurance companies usually play by the book and they follow the rules and they do really well because they just don't want, to be looked at. It does happen. Insurance companies are insurance companies, but for the most part, most of these companies play by the rules. So Medicare Advantage is Medicare, but administered by an insurance plan. The key to this, I think there's 3 things that you need to find out about Medicare Advantage plans. And this is sort of where we come in and help people kind of distinguish between, is traditional Medicare right for me or is a Medicare Advantage plan right for me? If I'm going to have an insurance company administer my benefits, the first thing I need to make sure is that my physicians accept my insurance company that I've chosen, right? So I will hear often that a Medicare Advantage plan tells me where I have to go to the doctor. They don't do that, no different than your group insurance tells you where you have to go to the doctor. The key distinction is my physicians are going to tell me which insurance companies they accept, right? Because it's to an insurance company's advantage to work with every physician in America. But I can promise you that not every physician in America wants to work with every insurance company. So the key question to a Medicare Advantage plan is, who are my physicians and which insurance companies do they work with? And we will help you figure that out. That's sort of our goal. The other question is, are my medications covered? And does my pharmacy like this insurance company? So two critical questions. I need to make sure that if I walk into a physician's office or a hospital, that they're not going to look at me like, a crazy person, that they're going to accept my insurance. And that same thing happens to me when I go to a pharmacy, and that I know what those costs are when I walk into a hospital or when I walk into a physician's office or I walk to a pharmacy. And the third most important piece is, if all my doctors are good and I have flexibility and I can travel and my drugs are covered and I like the price of this thing, what is the worst thing that can happen to me? What is the most money that I could potentially spend in a calendar year? Because that's going to tell you what your maximum out of pocket is and what your sort of your risk tolerance is, if you will. Um, if I'm paying, only the Medicare premium per month, and I'm paying co-payments as I go throughout the year, how much am I responsible for? If I have a major hospitalization or if I have a surgery or whatever the case is. If my max out of pocket is, say, $5,500 or $6,000, then I know that if my co-payments reach this $6,000 maximum, then my insurance company is going to pay 100% after that. If that's what my number is, then maybe I can live with that. If that max out of pocket is $10,000, maybe I don't want to do that. So everybody's a little bit different, and you've got these insurance companies competing. We represent the majority of these plans, and this is where I sort of kind of drill down and make sure, first and foremost, is the concept of Medicare Advantage right for you, or is a traditional Medicare plan right for you? And then which insurance company, if we choose this left-hand side, which insurance companies do we fill the blanks with? Which drug plan, which Medicare supplement? Or if we let it bundle through an insurance company, which insurance company is the right fit?
Hey, Eric.
Yes, sir.
So comparing traditional Medicare to the Part C, if you had 10 people come to you, what's the percent that you see
Yeah.
going to Part C versus traditional?
Yeah, I would, as of today, like 2025, I would probably say it's 80-20. So 80% Medicare Advantage, 20% traditional Medicare. But it has a lot to do with where you live, a lot to do with where you live, because a Medicare Advantage plan is an insurance company, right, offering Medicare benefits. So insurance companies are not going to be interested in going to Montana, creating a network of physicians and really growing that area because there's not that many people there. So you're not going to have as many options with Medicare Advantage plans there as you would with traditional Medicare, which is a federal, insurance. Supplements are just selling those all over the country for the most part. If I live in Birmingham, then heavily populated, the metro area of Birmingham has, I think a little bit over 1 million people. There are a lot of insurance companies here, right? But if I'm in maybe, say, Gulfport, Mississippi, there may be less, right? So it just depends on where you live and what insurance companies are available. So if you ask me, you know, in the middle of Birmingham, what do most people do? We have a lot of really good options here. 8 out of 10, probably Medicare Advantage. If it's Jackson, Mississippi, it may be 50-50. So just where you live makes a huge difference. So does that help a little bit?
Yeah, no, I think it does. I think that, just looking at it, I would have thought the majority of the people would have gone to Part C, but I was just curious what you actually see. Yeah,
Yep.
that
No,
definitely answers your question.
yeah, no, and it has a lot to do with everybody's risk tolerance is different. One thing that makes a huge difference in this conversation too is that spouses can do different things. Like this is not family coverage, this is individual coverage. So I've seen tons of times where one spouse needs to do one thing just based on either their risk or their medical claims or whatever the case is, and the other spouse does something completely different. So these are not family plans, these are individual plans. That's why, asking your friends and family what they did is nice because it kind of gives you an idea of what's available, but it doesn't tell you what you should do because, what you should do may be different than what somebody else should do based on just some, intangible that you're just not thinking of. And that's where we come in because asking the right questions is really important. And some of that just comes up in discovery, just through conversations that we have. Somebody doesn't think something's very important and then kind of off topic, they're like, well, you know, I'm really healthy, except, 2 years ago I had a triple bypass, but ever since then I've been pretty good. And you're like, oh, that's completely different. There's nothing wrong with that. There's plenty of ways we can find good plans for that, but that's just something to kind of keep in mind because I want to bring that up. And, if you do this, then this will be what happens. So it'll give you a better kind of working knowledge of, what happens when this happens kind of thing. So, and I appreciate Al giving me some time on this page because um, I think this page is very effective because it's a nice visual. Because this traditional Medicare concept, these different, when you define the A's and the B's and the C's and D's, it's kind of hard to see what's happening. But I think this page gives you a nice visual of this traditional Medicare concept, Part A, Part B, Part D, supplementing it with an insurance plan versus just letting an insurance company administer the whole thing. Um, and then where you live makes a big difference in what companies are available. Federal, this is, all of this is the same in all 50 states, but where I live and what county I live in. One quick thing about where I live, many people will hear commercials about zip code. It depends on your zip code. It has nothing to do with your zip code. It has everything to do with your county. Zip code is just a way of getting to the county. Um, it really has to do with what my address is and what county do I live in. Because in the Medicare space, every county is like its own little universe. So what's available in Madison County, Alabama will be completely different than what's available in Mobile County. There could be some overlaps, but you could have wildly different insurance plans available from Huntsville to Mobile. So big difference in counties are really important. Like Tuscaloosa to Jefferson County, they touch, but completely different markets. It's very confusing, but that's also, kind of what we specialize in. So I'm going to kind of keep going just to kind of jump through a few other slides. The rest of this will go pretty quick. This is really what a lot of people ask these next questions. So when can I enroll into Medicare? I do that at age 65 typically. During your initial election period, you can sign up for parts A and or B during a 7-month period that begins 3 months before your birth month, your birth month, and then 3 months after. So this is sort of your big enrollment period. Most people during this period sign up for Medicare Part A. If you're still working, you could probably waive Medicare Part B. That's sort of this next question. So do I have to sign up for Medicare Parts A and B at age 65? That's sort of a yes and a no question. So if you or your spouse are actively working and I have credible health insurance through your employer, and let's just say my employer is more than 20 employees, then I don't have to enroll into Medicare at age 65, right? A lot of people will ask, will I be penalized if I don't sign up for Medicare? If you remain as an active employee, you can delay enrollment into Medicare way beyond 65 with no penalties. You just have to be working actively and having insurance, whether it's through a spouse or through your own employment. Sometimes if an employer has less than 20 employees, you can waive Medicare. Sometimes you need to be on Medicare. It depends on the group insurance. It depends on what company it is, whether it's credible or whether the group insurance wants you to be on Medicare or not. So less than 20 employees, we have to kind of drill down a little bit about the insurance itself. But general rule is if I'm actively working and I have insurance from an employer, do I need to enroll into Medicare at age 65? It just depends. You can. One of the things that you can do is come off. So should I keep my employer coverage or go on Medicare at age 65? It really just depends on the cost and benefits. What insurance is available to an employee's dependents must also be taken into consideration. So let's just say that I'm turning 65 and I'm covered under my employer insurance, but I have a spouse that's 63. Well, if I come off the group insurance and I go into Medicare, what's my spouse going to do? So I may have to work a couple of extra years until my spouse becomes 65. But let's just say that I'm on single coverage, or my spouse and I both are over the age of 65 and I'm covered under my employer coverage. And let's just say that it costs me, $300 per pay period, and I'm paying, $600 a month for my health benefits, which is realistic in a lot of companies. I look at Medicare, I make less, my wife and I make less than $200,000 a year. Medicare, if I choose a Medicare Advantage plan, can cost me less than, $400 a month. I could easily save, $2,600 a year by being on Medicare compared to my group insurance. So I could continue to work, enroll into Medicare, and come off my employer plan. So it really depends, because employees who are age 65 have a choice that they've never had before. Should I stay on my group insurance, or should I go on Medicare? And that has everything to do with cost, dependence, what's my scenario? And that's sort of how we help a lot of companies and help a lot of employees kind of compare options and provide some guidance on how to kind of do that. Going back to, should I enroll into Medicare Part A? As long as you're not really contributing to something called a health savings account, then you don't really, there's no reason to not to enroll into Medicare Part A. If you're contributing to a health savings account and you're using that as a tax deduction, then there are some tax rules related to having Medicare Part A and contributing to an HSA. So we typically recommend that if you're going to continue to contribute to an HSA after the age of 65 and you're actively working, just don't enroll into any parts of Medicare. It's just safer that way from a tax perspective. And then when you do get ready to retire or stop contributing to that HSA, then we can start to move in the next direction of applying for a Part A and getting Medicare Part B at that point. One thing that people ask often is, let's just say I'm covered under group insurance and I want to come off my group insurance for whatever reason, whether I'm retiring or I've realized that my group insurance is just too expensive for me and my spouse. Well, you have special election periods. So a special enrollment period is if I didn't sign up for Medicare Part B or Part A, and I'm coming off of a group insurance, whether it's because I'm retiring or whether I've chosen to come off my group insurance. So you have the ability to do that at any point during the year, which is really helpful. And then there are some fixed enrollment periods that you have throughout the year. Those are October 15th until December 7th. That's the annual election period. We're coming up onto that. And then there's one other enrollment period that happens in the first quarter of the year, January through March. This is what we call kind of a Medicare Advantage open enrollment period, that if I've chosen an Advantage plan that wasn't right for me, then I can make a change to that during that time of the year. So you have special election periods, and then there's some fixed enrollment periods. A couple other just key slides. If I do want to enroll into Medicare, I need to do it in one of two ways. I need to do it at ssa.gov. In order to apply for Medicare through ssa.gov, I need to first have an account through login.gov. That's a new requirement that Social Security has. So if you don't have a login.gov account, I would highly recommend creating one. And then you have to go to ssa.gov and sign in using your login.gov sign in. Or you can call the Social Security Administration, schedule a phone appointment, and somebody will call you at a certain date and time to complete a phone interview to help you apply for Medicare Part A and Part B. If I don't sign up for Medicare Part B when I'm first eligible and I'm still working, then I need a form called a request for enrollment into Part B when I decide to come off my group insurance. That form is called a CMS 40B. Looks like this. We help people with these forms quite often. And then I also need a request for employment information form, which is known as an L564. This is something that the employer fills out. This proves that you've had insurance from an employer. And this is what keeps you from having penalties. One quick note that we highly recommend everybody to know is that if I've worked for multiple employers since I turned 65, you're going to need this form from each of those employers. Really important to understand that. We've worked with people who are 85 coming off of group insurance for the first time, but they've worked for 3 different companies since they, for the past 20 years. Well, they need one of these forms from each of those employers. So just a quick note that if you're changing jobs, you may want your company to go ahead and fill out one of these, keep it in a file. That way, when you become eligible or decide to enroll into Medicare, you have it. Thank you guys so much, just for listening to me throughout this conversation. You can see our phone number on the screen. I hope it's been very informative and informational. Our social media things are here. Recently, I've been doing more YouTube videos that kind of talk a lot more about our company and what we do, our website. We're on Instagram, Facebook, and LinkedIn, and all those kinds of things. Feel free to share information with friends and family or companies. We go out to, we do these for lots of employer groups. We do Medicare classes for churches, communities. Just anytime we get an opportunity to tell our story and help people have a little more confidence in how to make these decisions, that's what we do. And then individually meet with people to figure out, is this the right thing for you, or should you remain on your group insurance, or, does your company that you're retiring from provide you really good retirement benefits? Sometimes that's the case. So everybody is a little bit different, and we're just here to help however we can. So thank you guys so very much for the opportunity to speak to y'all today.
Great, Eric. Thanks so much. This is a great information on what can be a confusing subject matter. It's nice to know that we can contact your group and you can help us work through it. We're kind of pushed for time here. There's a few questions that were sent. We will answer those and get those out to everybody. But I want to thank everybody kind of on the viewing end of this webinar. And if you're a client of PBS or BMSS, we certainly appreciate your trust in us. And this will also be recorded. This webinar is recorded and will be put on the BMSS website for later use. But thanks everyone for your time. And once again, Eric, thanks for what you do. I know you're a great resource to PBS and BMSS. And so I just encourage everybody, if you've got questions, use on the screen right here, it shows you where to contact Eric and his team. So I guess that's it. Everyone have a great day, and thank you for participating.
Thank you guys so much.